So today's discussion is about pediatric cancers. Some myths and some real facts about pediatric cancers, what I was going to discuss in very few minutes. So the first question is, can cancer happen in children? So the answer is yes. Pediatric cancers, even though it's a very not common cancer or not a common disease, but still we have enough number of pediatric cancers in world as well as in India. Second question is, why pediatric cancer happens, or why this children gets cancer? So what you have to understand is, the cancer is not a lifestyle related disorder in majority of the people. So many of the times it is some genetic alterations or mutations which is producing cancers, especially in these children. Whether this genetic is hereditary, which you acquire from your mother or father, or whether it is acquired, that is different question. Many of the times it's hereditary, but majority of the times it's acquired. Number 3, what are the most common cancers seen in these children? So the most common cancer in this age group is something called leukemia or blood cancers. We have something called acute lymphoblastic leukemia. Brain tumors are very common in children. Then there is a particular tumor in the kidney called the Wilms tumor. Near the adrenal or above the kidney, you have an organ called adrenal. You have got something called the neuroblastomas. Then you have got something called lymphomas. And then there are rhabdomyosarcomas and variety of other pediatric cancers. But the leukemias constitute the major chunk of pediatric cancer management. What is the treatment for pediatric cancer? That is the fifth question. So like an adult, the pediatric cancer is treated mainly by the help of surgery, chemotherapy, sometimes radiation therapy. It depends upon the cancer site, but leukemias and all are managed exclusively with chemotherapy. In neuroblastoma or Wilms tumor, you require surgery and chemotherapy. For brain tumor, you require surgery, radiation and chemotherapy. But chemotherapy remains an integral part in managing pediatric cancers in majority of the extent. Next question is whether we should treat this child. So my answer is basically, you should treat. Because the cure rate of pediatric cancers is more than 90%. Whether you take it as an acute leukemias or whether you take as a Wilms tumor, neuroblastoma, majority of the children are cured. Whether you should you always worry because my child goes through this, my friend's child go through this treatment, whether these chemicals and all will produce bad things in our body. It's not correct, because all these are proven medicines which has been used for years, which has got short half-life. It goes or eliminated from the body after the effect. So you don't have a long-term effect of treatment. So majority of them feel that this child after getting cured in long-term will be crippled. Nobody is crippled. Everybody is active, doing their work, normal lives they are living, and the normal lifespan they spend. Last question is whether I should look at the finance in treating pediatric cancer. And that's the beauty of this pediatric cancer. There are a lot of initiatives either from the government or NGO side. There are a lot of organizations in India called this Hope, CanKids. There are a lot of organizations where all Apex institutes, you get support for treating pediatric cancer. Why there are this much support groups? It is because of the curability of pediatric cancer. So by thinking finance, you should not take a step that you are not treating pediatric cancer. Pediatric cancer is well curable and doesn't have a long-term side effect, and you should treat a child if he is diagnosed with a cancer. Thank you.